So today I thought it would be a great idea to cover how do you implement surgical remote monitoring? What are those steps that need to be in place? What do we need to think of as an organization before we implement a technology partner? And then after it's been implemented, what do we do to ensure its ongoing success? What do we look for in terms of early success and how do we continue the program long term?
I think it's a really important topic. And the idea I always go back to is if you, let's say you go on PubMed, right, and you look up research papers on remote patient monitoring in general, you're going to find a mix, right? You're going to find some papers that say remote patient monitoring dramatically reduced readmissions. And you're going to have others that say remote patient monitoring had no effect on outcomes. Even though if you read the methodology and the interventions, the technologies kind of sound the same on the surface. And I think the reality is that execution really matters to get an outcome. I mean, frankly, two different organizations can have the same technology, but one that executes well in the implementation can get fantastic outcomes, and the other who faces a lot of challenges in executing properly is not going to have a change in outcomes, even though the technology is the same. And that's why you get these papers with variable results, even though the intervention sounds almost identical. And so I think it's a great topic to show, hey, now that we're doing this for over 8 years, what have we learned along the way in working with lots of healthcare organizations in terms of best practices for actually making this sort of initiative successful? I think it's an incredibly important topic.
And so today I want to focus the discussion on implementing surgical remote monitoring. So obviously remote patient monitoring extends to pretty much every patient that is going to be at a hospital or a clinic, even for that matter. But today I do want to focus on surgical remote monitoring. So looking at the surgery department, how can we best utilize technology to help us prioritize surgery as we restart surgeries and as we get patients back into elective cases, but then also how do we leverage the technology to, like you said, improve outcomes, and what are those nuances that maybe some of these papers are not going in depth about.
Yeah, and the thing I'll add is that I think surgery is a particularly interesting topic in the time of COVID, when you're trying to maintain your services, but kind of minimize patient time in hospital and have safer, earlier discharge for surgery. And the neat thing about elective surgery in particular is that you can be very organized and strategic about actually planning your remote monitoring program around that whole elective experience. You can educate a patient earlier on the journey that you're going to have this initiative, right? Whereas for a lot of other non-surgical experience, let's say a patient was admitted for an exacerbation of their heart failure, they weren't expecting to get remote monitoring at all. So if they're at discharge and you're trying to put them on this program, that can be maybe a challenge. But with surgery, you can use remote monitoring pre and post surgery and have a much more seamless, streamlined patient experience with the platform as well. So there's lots of, I think, reasons why, especially during COVID, surgery can be a really great use case to get big benefits out of remote monitoring.
Yep, absolutely. So first, I think let's just cover so that our audience knows what we're talking about. What is surgical remote monitoring, or what is a surgical remote monitoring solution? And the way I would describe it is it's technology that transforms a patient's own device into a virtual companion, basically guiding them from, like you said, preoperatively. So it could include prehab, for instance, all the way through post-op recovery. So from, let's say, it could be as early as 30 days before the surgery or even longer, to, let's say, 30 days post-op while they're recovering. So it's providing them evidence-based, surgery-specific pathways customized for the actual protocols of the particular procedure. And it's enabling patient monitoring of symptoms post-op. So looking at pain levels, incision photos, things like that, while supporting the patient with ongoing education. So this education in the pre-op stage is obviously important to get them ready for surgery and prepared. And then in the post-op stage, it's meant for self-care guidance, educating them along. And if there is a risk or a symptom that's popped up saying, hey, this needs attention, then it also has the ability to generate those flags for the care team and also let the patient know what they need to do if maybe escalation is needed. So triaging the patient to the right providers.
I mean, Alan, maybe just to unpack that, just to make it a bit more visual. So so this would be like, imagine a patient is going through a total knee replacement. So preoperatively on their phone, on their tablet, or even through their web browser, let's say a week before surgery, they would get an alert saying, hey, it's time to stop your blood thinners. Or, the night before surgery, they get an alert saying, hey, here's the time to start your pre-surgery chlorhexidine wash. Tell us if you've done it or not. Here's education on why you should do it. And then, post-op, let's say they're in hospital, the patient gets another alert saying, hey, it's time to mobilize today and here's how to do your physiotherapy exercises. And then when they go home, they can be prompted to track their symptoms and recovery issues, right? So patients can be prompted to track, what's my pain level, take a photo of my incision through my phone, send it to my nurse, catch an infection earlier. And you're saying the nurse can have, let's say, a dashboard on their browser showing what do the pain scores look like since the patient's gone home, what does their incision photo look like, and they're able to kind of flag those issues much faster, and then not only manage patient issues as they come up and prevent a readmission or a revisit, but the fact that they have this connection now means that the patient, the provider could say, hey, you know what? You can have a same day total knee surgery during COVID because I'll see what's happening to you the first day you go home through this platform.
Yeah, great explanation. And you've already alluded to it, but obviously the technology has the ability to lead to improved outcomes like reduced cancellations, even length of stay, like you're saying, with the same day discharges, confidence to inspire, patients can go home early because they have the right exercise videos, they have the right education, and they're connected to our care team. We're monitoring everything that's happening with them. So obviously reduced readmissions, ED visits, like you mentioned, and overall just total cost of care. I think the last part of the technology that I want to highlight is that all of the patient reported outcomes, so in this case, even compliance to protocols, as well as general PROs like pain scores and anxiety scores and things like that. All of that data is collected by this technology, and then it's stored for the hospital and the care team, easily exportable. You can use it for research, you can use it for quality improvement purposes, and it's ongoing.
So Alan, I'm a hospital, I'm a surgical program director. All right, I'm bought into the concept now. Mm-hmm. But I guess like I need to find technology to use for this, a platform to use. So how do I go about finding the right partner?
Right. So, I mean, first thing, obviously just choose SeamlessMD, but aside from that, I'm kidding. Basically, I would say a couple things. One thing that I want to highlight is we do have an episode on the podcast on the topic of building versus buying technology or a surgical remote monitoring program. So definitely check that episode out if you do have the resources and are wondering if that's the route to go. But I think, Josh, you're right. So we need to look at how do we choose the right technology partner? And I'd say the right technology partner will provide both a proven, effective technology platform and have high quality professional services in the form of maybe an extension of your team that can help support your success ongoing. So in terms of the specific components to look for, I'd say there are a few key technology components and a few key service traits to look for. The first three that I can think of off the top of my head, one, make sure that it's multi-platform. So meaning it's available on a patient's smartphone, their tablet, their computer, basically any device, because you want to be able to ensure that patients can use the technology. So accessibility is super important. And then also caregiver access added on to that.
Yeah, and it just reminds me. So I remember when we first started Seamless many years ago, when we were doing hip and knee replacement for the first time, one of our first partners let us come in and actually sit down next to their patients who were having a total joint surgery and kind of watch how they would interact with our platform. And I remember there was, this patient, she was probably in her 80s and she took out her iPad. So she had an iPad, right? But then when we watched her interact with the program and try to set it up, we realized, oh, wow, okay, she doesn't know her Apple App Store password. So she actually can't even download an app, but she can, but she'd be able to use a browser-based version. She could get the email reminders. And so I think we learned early on that you can't assume that just because a patient has a a mobile device, that they can even use an app. And so to your point, Alan, being available on, yes, on apps, but also the web browser, having text message reminders, having the full suite of channels for patients has been really critical for accessibility.
Absolutely. Great addition. The second component in terms of a key technology trait that I can think of is that the technology partner has out of the box clinical pathways that are customizable. So, maybe the technology partner has done same day hip replacement pathways before. Well, now we can implement that same pathway and customize it for our protocols and use our education if we'd like to. So the care plan's already kind of built, which makes the process just a lot easier.
Yeah, and I think it's one of those interesting things where, I mean, we do realize that every hospital does have their own, booklets, right? You have your 50-page booklets. But I think the thing that's often missed is that it's not like we're just taking your 50-page booklet and then you're just emailing the patient a 50-page PDF. I mean, you can do that already. You don't need a remote monitoring platform for that. But if it's about, hey, I want to actually have reminders for these 50 different things, or I want to have I want to track these, 10 symptoms, and I want all these specific, branching questions based on what the patient answers in for each of those symptom tracking questions about pain or nausea or knee range of motion. And oh, by the way, I want to have all these different alerts for thresholds if their pain is too high or their temperature is too high. And oh, wait, by the way, like should the threshold be 8 out of 10 pain, 6 out of 10 pain? So there's all these nuances about the out of the box pathways that when a partner has done it before, you're not having to start from scratch. You can say, hey, like what worked for these like 10 other organizations for total joint replacement? Can I just like take what's worked and then customize it a bit more to match some of my needs? But I think people often realize there's all these nuances around a program like this where there would be a ton of trial and error to design a pathway from scratch.
Yep. Actually, there's just one term in there that I wanted to unpack. You mentioned branching logic or branching questions. Just for folks who might not know what that is, branching questions is basically if a patient answers X, then they would receive a different question or a different education compared to a patient who answers Y on the let's say a survey or completing a checklist activity. So it's basically an intelligent platform that chooses when to send which piece based on the patient's input. So another technology component is around the dashboards and analytics. So like we mentioned in the beginning, there's the ability to monitor patients' activity once they've left the hospital. We need to know what's going on with their symptoms, what's going on with their pain levels and their wound, and we need to see photos of that. So basically a technology partner that I would choose would be one that has robust dashboards and analytics where you can actually see patient engagement and activity levels, as well as all of these patient reported outcomes, and maybe even establish what the trends are for the population, and show it maybe in a graph format so it's easy to digest. And then I think third on that would be the survey response rates in general. So if you're sending out for, let's say, let's keep using that hip example, maybe we have a HOOS survey that's going out and we want to collect that from our patients. Well, we need to ensure that we get the right response rates, and we need to be able to see that back and then actually see what the survey responses are there as well.
Yeah, and this also goes back to the whole build versus buy thing, because there's all these nuances around clinical workflows and how should a notification show up for a provider, or what amount of information do they want in a notification? What are those care coordination tools around flagging patients, starring issues, all these little things that we don't think about, but then take years of iteration with frontline staff to figure out like what's the right way to enable remote monitoring of this data in a way that fits the clinical workflow. Which if you're doing from scratch, again, like you're just trial and erroring it. And then, I mean, to be honest, like you can frustrate providers if they feel like they're the guinea pigs having to figure this out for the organization. So that's the trade-off if you don't want to go with a vendor who's done it before.
Right. Yeah, absolutely. And I think going off of that, with a vendor who has done it before, you should be looking for strong clinical evidence. So they've done it before, but they've also done it successfully, and it's actually had an impact on outcomes. So looking at the clinical evidence that the vendor has, as well as customer references. So you can't always just rely on what the vendor is saying. I mean, it's in their best interest to try and get you to use the product, but actually speaking to their customers and looking at what their customers have said online or in various panels and presentations. I think that's really important as well.
Oh, it's huge. And I mean, part of it is how similar are these other organizations and those case studies to what I need done in my organization. So I'll give you an example. I mean, and by the way, like this really became real for me when I had to be in a similar situation for picking a new vendor for our company. So, we went through a recent process where we were just getting a new professional services firm for part of the company. And the big thing for me was, okay, but, we're a software business, do you have another, customer that is, or two that is like me? So I know you understand our needs. And they were able to mention, oh, we work with this other healthcare software company. And I knew the CEO of that company. So all I did was, I emailed him saying, hey, like, I don't need a call with you, but like, just tell me out of 10, like how highly would you rate like your experience working with that vendor? And he was like, oh, like 10 out of 10, absolutely happy to, talk to you if it helps to give you more info. I'm like, no, I don't need a call. I just really want to know, like, okay, because I know you're like me, right? Your company's like our company, and you're saying they were able to help you with this. That just gives me enough to be like, okay, like I have enough social proof from someone I trust. Whereas, yeah, like if they didn't have anything, like I'd be like, I'm not so sure if I want to like look for another vendor. And then to your evidence point, it's really important because again, like there's a lot of products out there that I've seen where, yeah, the screenshots look great. I mean, it looks like you have some great engineers and designers, and the platform looks like it has functionalities, but has it actually worked for anyone? Has it driven an outcome? Because I can tell you, there's a lot of really cool looking software applications in healthcare that, for whatever reason, there's no outcomes, and it makes you wonder, well, like, what are we getting into here? Is it proven?
Right.
That stuff matters.
Yeah, that's a great point, and I think that also speaks to how the product is implemented. Which is another point in the criteria. Two other technology components that I just remembered. So the first one, and it's kind of table stakes at this point, actually both of them are, but having a strong EHR integration engine. So being able to actually integrate with the existing electronic health record or electronic medical record. Obviously, that's very important for keeping things consistent and in one place. It could be enrolling patients from the EMR, it could be viewing these dashboards back within the EMR, could even be on the patient's end accessing the platform through their patient portal that they're already using with the hospital. So all of that is very important, and things to look for in terms of the vendor partner is, do they have relationships and have they actually integrated with those electronic medical records in the past? So a good example is with Epic, they have their App Orchard program. And so is the vendor partner actually on the App Orchard? Can they integrate using the newest frameworks? And same thing with Cerner, they have their code program. I think Allscripts has a program as well, and Meditech, and all the major players in the EHR space have their developer programs. And so just make sure that the vendor partner that you're choosing is associated with them.
Oh, it's a great point, Alan. I mean, I'll be honest, like I've seen lots of companies where you go on their website and they'll say, oh yeah, we can integrate with Epic, Cerner, et cetera. And you can?
Right, have you?
And if you ask them, they'll go, oh, well, no, but technically we can, like we have all the right info. And so you're right, Alan, like, I mean, do a simple search. Like you said, go on Epic App Orchard, go on Cerner Code, look up the company. If it's not there, I mean, like, who knows? Yeah, maybe they can, maybe they can't. But that, I mean, also if they're on there, it's a much faster integration. That's another topic.
Right. And going back to your earlier point about not wanting to be the guinea pig, it's like maybe it's a significant discount and it's in your interest. Let's try it. We don't know if they can integrate, but we can be the guinea pig. Or you can go with a trusted partner that's already integrated and it works really quickly and gets up and running. The second tech component that I was thinking of is just around security and privacy. So again, table stakes, but make sure that the partner has very strong security and privacy infrastructure in place to protect patients' information. And then the last piece, I think, when choosing the vendor partner comes down to exactly how is it implemented. So is there an actual team that you're getting as an extension to your own team from the vendor? Do they have an implementation playbook? Have they implemented before successfully? And do they have ongoing, I'd call it like advisory services, where they can actually help you in terms of your success criteria and meeting those goals, and do they actually have the right information for you as you move forward?
I think that is so critical, but it's very underrated. I think in healthcare until you actually implement a remote monitoring program, and then you realize, oh, that like really great partner service has a very high correlation with outcomes and results for the program. And the way I think about it is, yeah, I get it. If you were just installing Microsoft Office and Outlook, yeah, you don't really need a great implementation partner. You don't need a great advisory customer success services partner. It's just Outlook. I mean, it's pretty intuitive or whatnot. But imagine any other sort of initiative you've had to implement in the clinical workflow, in the hospital workflow, especially initiatives around quality improvement that touch, the patient journey. And you realize how important it is to have a change management partner who understands how do you educate a patient on these initiatives? How do you actually get high adoption? What are the best practices for monitoring patients? I mean, those are things that are far more complex than just, how do I use Outlook? I mean, it is technology, but it's a different context. And so even though we put it at the end of the list, I almost feel like you could argue it should be like the number one thing on any list in terms of importance. And you won't get that from just looking at product screenshots.
Right.
You really have to dive into be like, okay, well, what do you guys do for us outside of giving us the tech? How do you I think organizations don't ask this enough. Like, what do you do to make us successful with this? What support do we get? And if the answer, frankly, is, oh, we give you tech support,
right?
I'd be like, hold on a second. That's all I'm getting, tech support. I'd question the partner.
Yep. I think another piece. So before implementing the technology, it's important to consider which use case are we actually going to implement for. So basically identifying what the priority use case is. I'd say, and we've already mentioned this, but the value of surgical remote monitoring is correlated with the clinical area and the impact that you can have and how far you can scale that impact. So because
before we get there, could I just quickly comment?
Yeah.
I think what we're not saying is like, oh, you have to like only pick one. I mean, you might have decided, hey, these are 10 surgical areas I want to put this in, but you want to be thoughtful about what's the order you do them in, because you want to pick the right one for the first use case, because the next 9 are gonna ask, well, who's gonna be the first one? How did it go for them? And what can we learn from that? And so you want to be very thoughtful about the order that you do it in. Anyways, Alan, I'm back to you.
No, that's a great point. And that's pretty much in line with what I was thinking as well, is just, all eyes are going to be on this, especially if it's a new technology, a new implementation. So you want to make sure that you're choosing the right program or programs to set up with first, because everybody's going to be looking at the success of that as you scale. So I'd say there's a few factors to consider when you're choosing your initial use case. 4 main factors that I have on hand. Number 1 is the availability of a clinical champion. So especially because this is a surgical program that's going to have education, protocols, patient management, everything is for the surgery team. You want to make sure that there is a clinical champion who's on board with the idea first and available to review the protocols, make sure that everything is in place, and make sure it's all up to what their standard would be that they're delivering to patients.
Yeah, and maybe on that note, just to underscore the importance of that, you kind of want to know there's a difference between a champion and a supporter, right? Like there's a ton of, let's say, surgeons who would say, yeah, like I think it's a great idea. I think that program is important for a patient and we should do it. But don't mistake that for someone who's a champion. A champion is someone who says, oh yeah, like I would want to lead this. Like I'm all in on this. I'm willing to bring people in the room. I'm willing to like champion it forward. And a question that we found helpful with partners is asking, a potential champion, hey, like if this were to happen here, right? Would this be your baby? Would you be the one who's like leading it? And if it's the champion, they'll say, oh yeah, this would be my baby, I'll lead it. But sometimes they might go, oh no, like I don't have time to lead this. I would definitely support it. Yeah. But you wouldn't have known that unless you made the ask. And so it's really critical that they actually ask themselves, like, is there a really motivated surgeon or clinician champion for this who would, and again, it's not like they're doing all the work, but they have the most to like be motivated by and make it
Yeah,
their baby.
that's right. Yep. I'd say another factor to consider when you're trying to identify what the priority use cases are, these two kind of go hand in hand, but case volume. So, is it a procedure type where we have 5 patients a year or 20 patients a year, or is it a procedure type where we have thousands of patients a year? Obviously, the larger the volume, there's the greater room for improvement at scale. And then this next factor kind of ties in with that, but the risk level of the procedures as well. So is it a high risk procedure where there is opportunity for, let's say, lower length of stay, fewer readmissions, there's a big opportunity cost there. And then you combine that with the case volume, that should give you a pretty good quantifiable measure for a good priority use case. I don't know if you have thoughts on that.
Yeah, maybe you'll give some examples that help illustrate like where we've seen partners start and why. So I would say, for example, we've seen a lot of folks start in total joint replacement. Why is that? Well, it checks off your first box, often has very high volumes in a hospital, right? So a lot of programs will do anywhere between 500 to 2,000 total joints per year. So, very high volume, you'll see success early. So check mark that box, right? So it's kind of like, if you're going to put in the work to implement this program, customize a pathway, you'd rather put in that effort for a large program than one that, like you said does 50 per year, right? So total joints checks that off. Around does it make an impact on outcomes because of the risk level? Well, I mean, there's not a high risk of readmissions or ED visits with total joints, but more and more groups want to have, same day total joints, but they want to and ensure the length of stay, but they want to be able to do that safely. Right. And so having a surgical remote monitoring program for total joints checks that box. I think that the third one, which is also maybe not the most important, but does help, is the patient education needs, right? So total joints has 50-page booklets.
Right.
So the more that you could package that into a streamlined digital experience that you can break up into bite-sized reminders and pieces are a nice secondary benefit. Mm-hmm. And then I would say on the flip side, maybe one that wouldn't check off the boxes so much would be something like I don't know, wrist surgery or ankle surgery. Mm-hmm. It's like, yeah, those are important procedures, but there's not a high risk of problems. The instruction set isn't as comprehensive. The volumes aren't as high. And so it's not that you would never want to do it for those patients, but if you had to pick,
right,
you'd probably
at
pick
least where to start,
or your wrist surgeries.
Right, exactly. Another example, cardiac surgery comes to mind. So again, high volumes and room for improvement in terms of an impact on outcomes. With cardiac surgery, we're looking at readmissions as well as length of stay. There's an opportunity on both ends. So I think that fits in line. And like you said, patient education need. There's lots of education needed for both of those examples. And it is true in our experience that does seem to be a priority use case that comes up often.
Very true.
All right. So next, when implementing the technology, before implementing it, I think it's very important to establish what is the success criteria. What does that look like? What's it going to look like? What are we measuring the success on? And I think it's important to do this upfront because it's going to inform how you want to implement the technology into your workflow. And we'll touch on workflows in a little bit as well, but just as an example, if readmissions prevention is your priority, you're trying to prevent readmissions, then you probably are an organization that will want and will benefit from having those real-time alerts and the ability to monitor patients. With surgical remote monitoring, and we will touch on this, but it's not necessarily that you need to have an active monitoring available. So you don't need to have team members actively looking at dashboards and monitoring patients. But if your main goal is readmissions prevention, then that probably is the route that you'd want to go. But knowing what the goal is that you have in mind first will help dictate what type of workflow you want to be using. So success criteria to consider when you're building your overall success criteria, I think revolves around 3 main things. So the first is patient engagement, which can be kind of broken down into patient adoption rates. So how many patients are actually signing up and enrolling onto the platform. And then it also encompasses usage rates. So how many patients are actually absorbing the education on it, filling out some of the surveys that you want them to fill out, doing these, what we call health checks, so monitoring their symptoms and actually inputting that into the system. Those are the patient engagement results that I think are very important, especially in the beginning. Once you're implementing the technology, it's really crucial that you get patients actually using it. You work out all of the bugs in terms of your processes and workflows to make sure that patients are using it.
Yeah, and Ellen, just unpack that, like, and this is why I think it's two things on that. One is if there's no engagement, you're not going to see any change in outcome. So if you're not able to get the adoption and engagement right, then forget about even trying to move length of stay or readmissions. But the second comment I'll make is, and this is why I think having a partner who's not only done it, but has a great customer success advisory services team is, if you're an organization and you're doing it on your own and you're wondering, well, like, what's a good enough adoption rate? What's a good enough engagement rate? How should I measure that? How do I know that that this amount of adoption or engagement is likely to lead to a real benefit on outcomes? Gosh, good questions. Kind of wish I had someone who could tell me that, right? And so, one of the things that we often do with our partners is we can show them, hey, like, here's anonymous kind of examples of other partners who, also have a total joint program and have similar populations, similar volumes, and here's what their engagement and adoption numbers look like, and here's the outcomes that they get, so that hey, like, an organization like me, this is what is possible, here's what's expected. Otherwise, you're kind of in the dark.
Yeah, and I mean, it's maybe common to look at, well, what's our patient portal adoption like, and is that the benchmark? And the truth is, that's not the benchmark that you should be looking at. When it comes to patient engagement, the benchmark should be much higher, because this is all of the education, all of the protocols that you want your patients to follow. It should be as close to 100% as we can get it. So maybe the benchmark for that would be around 80, 90%, and above. The second success criteria to consider is around the patient self-reported data. So looking at things like patient satisfaction. So understanding that the patients actually derive benefit from using the program in general. And I think beyond just the patient's benefit, is there provider satisfaction? I think that's important as well. Are providers actually happy with the connectivity that they have with patients? Are patients actually feeling connected to their care team? And do they feel like they're being supported at all times by the care team?
Yeah, one of the things that we do at Seamless is, as part of the platform experience, we send out automated feedback surveys to patients at different time points in the journey, and actually find out, hey, like, what's been good about your experience so far? What's been the best part? What's been the challenging or frustrating parts? And that's been very enlightening to help us not only improve the product, but I think very importantly, it provides an avenue to give feedback back to the care team on, like, what's going well. And so, we get all kinds of patient comments about, wow, like, I felt, more connected and less alone. It answered questions that I would have had to call in about. We caught a complication, or we caught a blood clot earlier. The experience was 100 times better with this than my previous surgery, where we had no monitoring program. And that sort of feedback also has been really motivating for the frontline staff, because oftentimes, like, they don't hear from patients about, like, hey, was this good or not? True. So the fact that we intentionally collect that data in the platform and feed it back to the staff is very powerful. I mean, you forget the platform. Normally the staff aren't getting feedback from patients on experience. So now we're actually collecting that for them. It's a big motivator for the program.
Yep, definitely. And then, of course, the last success criteria to consider is around hospital chart review. So actually looking at those outcomes, is there an impact on cancellations, length of stay, ED visits, readmissions, costs, obviously. One that you did mention just casually there was around phone call reductions. That, I feel like that's a great metric as well, because the technology is really answering questions for patients as they go along. And maybe that's avoiding a phone call that they would have normally placed to the clinic again. Same thing with follow-up visits. Maybe because we can see how the patient is progressing, maybe we don't need a follow-up visit as quickly. Maybe we can tell patients doing fine, everything is on track. They don't need to drive, the 3 hours back to the hospital to have their follow-up visit. That would be 5 minutes anyways. We can do it. We can conclusively determine we can either do it remotely over a Zoom call, or we don't need it at all, and maybe we can just get rid of it. So hospital chart review is the last success criteria to consider there.
Yeah, and the thing that I would also say is that, like, what you described, like patient engagement, patient self-reported satisfaction, and then hospital chart review outcomes, like I would say that's on a spectrum from what I call leading to lagging indicators. So like when you first start the program for remote monitoring, you should focus on patient engagement because that's the data you'll have at the beginning. Then like, later on, you start focusing on patient satisfaction data as data comes in about the patient experience. And then closer to the end, yes, now you have enough of a sample size to look at hospital chart review. I would say the minimum we tend to look at is, once you have 100 patients through the program, then comparing those outcomes to the previous 100 patients before you went live. Most organizational leadership tends to view that that's the minimum number to believe the data and be and have a thoughtful discussion about it. But the point is like you won't be able to see that 100 patient data points until you've gone through those 100. So you can't do all of this at the same time is what I'm saying. You intentionally want to go in that order, but that's fine too because it gives a team something to focus on along the way in that journey.
And like you said, they are leading indicators. So if the engagement is strong, you're probably going to get pretty strong satisfaction scores. You're probably going to see outcomes improved should everything go correctly. All right, so we kind of touched on it, but if your goal, let's say, is readmissions prevention, like I said, you're probably going to be wanting to monitor the patients, and that requires staff availability. And so I think it's important to establish, who is the team and what are the roles going to be and responsibilities for when we have this implemented. And it's very important to think about this up front and not kind of scramble after the fact and realize, oh, there's, either too much work or it doesn't fit with our workflow or whatever the case may be. I think effective teamwork repeatedly separates successful surgical remote monitoring from a failed initiative. And if you're implementing surgical remote monitoring, obviously we're not looking to have a failed initiative. So it's important to first kind of map who the different stakeholders are and what their roles are before implementation or during implementation, and then what their roles would be after implementation. And I don't want to give the idea that it becomes a lot of work, because it's really not. And you can talk to successful teams who have implemented it, and you actually see it's reduced a lot of work for the majority of the teams. But let's go over what some of the roles are before implementing, and then how the roles change after implementation.
Yeah, absolutely, Alan. So maybe I'll start. So you do want someone who's like a project manager, and it doesn't mean you have to like find a project manager. Yeah. It's kind of like who's the main coordinator of this initiative to kind of handle any day-to-day aspects of it, to coordinate things with your technology partner. And so this might be an actual project manager, or it could be an existing team member. Sometimes it's a clinician, a research analyst, a QI analyst. I mean, whoever you have that's available that would be motivated to kind of be a point person on this is the right person for it. And kind of they are the, basically the project manager before implementation, and then even after it goes live, like they're still kind of the main point of contact, and they facilitate the ongoing success with your vendor partner. I think the next thing I think about is, the physician champion, and they kind of like, advise on success metrics. They lead the physician engagement. They motivate others to get involved. Because of their schedules, they're not the doing the day-to-day stuff, but I think they're a key cheerleader throughout. And they would make sure that all their physician partners are on board with this during implementation. And then after it goes live, physicians aren't the ones who typically are monitoring patients, if you're monitoring at all, but often they're the ones who actually will look at the aggregate data you've collected. So maybe once a quarter, they'll say, hey, let's look at the pain scores that we've collected and see if we can improve those. They're also often the ones who collaborate with hospital administrators to set goals for the future, define the strategy going forward. And again, that physician champion was critical to even make this happen in the first place. I think another one that we often forget is kind of the administrative champion. And so, usually someone like a director of surgical services, sometimes they're a VP of peri-op, or maybe a C-suite sponsor. And it's not that this person is frankly doing a lot of day-to-day, but they end up being very key early on to help define, well, what should be the first use case that we can say is a priority for the organization. they often are leading, well, what are the success criteria, whether it's length of stay, readmissions, patient satisfaction. And then after it goes live, like you want that person coming to any, quarterly reviews of the data and the progress. You want to make sure they know what's going on, and they're going to be an ongoing champion from the executive level for you. And then after that, I think there's a lot of other folks who are more involved in the day-to-day. So, nursing and allied health, they're, in the implementation, providing feedback on the pathways, the workflows. They're kind of helping to advise on like, what's the patient journey and how should we incorporate technology into it. And then after it goes live, that frontline staff is involved in educating patients on the initiative, potentially if they want to get alerts and dashboards. And then, of course, to get the patient on board in the first place, the medical office assistants or other coordinators are involved on onboarding the patient in terms of enrolling them into the back end of the platform, signing them up. And then maybe just lastly, I'll quickly mention, like, even though integration with the EHR might be optional, certainly if you decide to do that, they should be involved. And my bigger thing to come to make, and I'll shut up for a second, is that it's not like we're saying you have to involve a gazillion people for this. I think the underlying thought is, if you want this to be successful, what you don't want is that you didn't involve someone, or at least educate them on what you're doing, and then they get upset later that they weren't involved in this process of, being part of this. And I think what we find is that when you include the whole interdisciplinary care team, from frontline staff all the way to a hospital administrative champion, it's truly a team initiative. There's a sense of ownership and camaraderie, and that alignment makes it successful. If you try to make it too small, where it's like, oh, we're just going to include one physician, one nurse, and a project manager, and you kind of,
leave
box everyone else out, it's not going to work. It's not going to work. Like, you need to have this whole team aligned together. And again, it's not like everyone has to be involved to the same degree. You need like one physician champion. You need one administrative champion.
Right.
You need a core team that makes it work. And I'll stop there, Alan, but hopefully that gives a bit of insight.
That's fantastic. And I think also that's why we find these types of initiatives, like a surgical remote monitoring initiative, it kind of works hand in hand with like an enhanced recovery initiative, because the team is already there and they're already rallied behind something. So if you have, let's say, an ERAS program, then adding this technology component just goes so hand in hand with that, because it's generally the same team. Let's just put everything on digital now and be able to monitor. Not suggesting you need to have an enhanced recovery program to use this type of monitoring solution, but it definitely makes the process easier because the teams are generally consistent. All right, so next thing on how to implement the technology, I think this is one of the biggest misconceptions is around workflows. So how do we actually enroll and monitor our patients? And I think we've come up with kind of three main, or the top three workflows that we see at SeamlessMD with different organizations, some of our partners.
Yeah, and Alan, may I just quickly ask you? So this is like the big question that we get asked. Like, if I'm doing a surgical remote monitoring program like yours, does that mean I have to have a nurse or a full-time staff who is monitoring patients every day? That's the big question we get.
And the answer is no, you don't. And I think that surprises a lot of people, because they hear, and partially it is because of just what the category is called. Surgical monitoring, remote monitoring. It sounds like, well, we're monitoring. We need to have all hands and we're actually, seeing what's going on with the patient. But the truth is there can be a completely hands-off approach. And so there's kind of three workflows. We call them like a hands-off approach, which I'll get into. There's a hands-on approach, and then there's an approach that we've labeled supercharged, where it's basically like a high touch, very hands-on. And I'll explain the differences between these three workflows and what the benefits are between these three workflows. So the hands-off approach, when we're thinking of hands-off, it's basically patients learn about the program, maybe from a brochure. You don't need to actively educate them on the program. They find out about it maybe through the website or an email or a brochure. So it's completely hands-off in that regard. When you're actually educating the patients, you're maybe just explaining about the program at enrollment, and then everything else from there is completely automated and guided for the patient. So basically the patient receives all of the education that they need at the right time. They get all the reminders, they can fill out surveys and access their education. And if there is a problem that comes up, maybe they've reported an abnormal pain score, maybe it's an 8 out of 10 pain, or maybe they're experiencing some dehydration, or there's, a sign of some sort of issue post-op. In a hands-off approach, the patient actually just receives information like call this specific person or visit the ER in extreme cases. But the patient basically gets the information as to what to do to escalate. It's not on the care team to actively monitor and catch these signs. So it's completely patient self-driven and automated for the patient.
And Alan, just I think part of the challenge is that Seamless is actually very unique in this workflow. So I would say for pretty much every other, remote monitoring platform, it really is remote monitoring where yes, you need a nurse to monitor that data. Seamless is, I think, one of the few platforms, or maybe the only one that has both a patient self-monitoring platform where, like you said, we don't need a provider. They actually can prompt the patient to reach out and escalate on their own. And we also have the remote monitoring with alerts and dashboards for nursing and other staff. So I think that's part of the challenge where pretty much every other solution out there requires someone. We've just been a bit more, I think, unique in our approach to cover different situations for our healthcare teams. So,
yep, absolutely. And I think it's also just important to mention if you were going with the completely hands-off approach, it's maybe 30 seconds needed to enroll the patient. So hand them the brochure, tell them, hey, I'm going to enroll you in this program, or ask for their consent if that's the workflow. And then in terms of live monitoring, like we're suggesting, it's all on the patient for self-management. So there's no time needed there. Moving more towards the hands-on approach. So this is the second workflow around more of a hands-on approach. What that means is maybe we're still handing the brochure to the patient to explain what the program is, but now we're maybe adding on some verbal education as well. So explaining the benefits of the program, explaining how we're going to be able to stay connected with the patient as they've left the hospital. And so there's an additional time commitment in terms of educating the patient, not long, like maybe it's an additional 2 minutes where you're explaining what the program is and how it's going to work. And then there's the ability now to actually use these monitoring dashboards. So maybe we have 1 or 2 care navigators who are receiving alerts if there's a patient that's fallen off track, or a patient who's reported a symptom that is at risk. And so they can actually monitor these patients on the dashboards. And I think what we've found is that maybe they spend between an hour or 2 per week looking at these dashboards. So if readmissions is the goal and let's reduce readmissions, then you probably do want that monitoring, that live monitoring component, because we can then follow up on here's the patient's at risk, and we can clearly identify it quickly to potentially mitigate some of those problems that come up.
absolutely. At the end of the day, it's like you honestly, you get what you put into it.
Mhm.
It's not a magic pill. I mean, that's just reality. It's a great enabler of preventing readmissions if you're willing to put in the effort. But yeah, it's not a magic pill.
Absolutely. And I do want to mention as well, the hands-off approach has reduced readmissions for some of our partners. For instance, like the Montreal Heart Institute, I think their readmission rate dropped by 10% with a fully hands-off approach. So no monitoring at all, just the patients knew exactly what to do, when to do it, and definitely could have an impact on readmissions and ED visits there. So we've covered the hands-off approach, we've covered a hands-on approach. Now let's talk about what we call the supercharged approach. And the supercharged workflow is basically the hands-on approach, but we're going to educate the patients even further. We're going to maybe show them an actual demo of the product where it could be a nurse that's actually walking the patient through and explaining how to use the different education, how to access the reminders and the task list and the surveys that might come up. So the actual time points where you're going to educate patients on this includes kind of all phases of care. So in the pre-op clinic, maybe when you have your pre-op appointment, your assessment with the patient, you're going to float the idea by them. You're going to explain what the technology is. And then when the patient comes in for their surgery and they're in hospital, you can then educate the patient on here's how the program's changed to now an in-hospital component where it's going to tell you, when to sit up in bed, when to walk around, when to mobilize. And then same thing, you can educate the patient once they're leaving the hospital. You can explain how it helps you stay connected to our care team. And I think the main difference in the supercharged workflow compared to the hands-on is how we use those alerts and dashboards. So if you remember in the hands-on approach, we had maybe 1 or 2 care navigators who are receiving these alerts and monitoring patients. In the supercharged workflow, we can actually customize those alerts even further. So we can say specific team members get specific alerts. So let's say it's a wound issue that the patient has, and we want to alert the wound care nurses about that issue, or maybe it's a diet issue. We want to alert the dietitian about that issue. So it's basically customized in terms of who gets the alerts and at what point, and then the dashboards that are available. And so I think the partners who we have that use more of that supercharged approach, they spend on average between 5 and 7 minutes educating the patient on what the platform is. So 5 to 7 minutes per patient on education. The enrollment stays the same. It's around 30 seconds to possibly a minute, depending on how complex the procedure is. But then where it really changes is with the live monitoring and follow-up. They're spending on average, it's about 15 to 45 minutes per week per care team member. So per member who is actually monitoring. And I'd say this approach is more distributed across the entire care team, again, depending on what the risk is that they're monitoring. So again, a wound care nurse would look at wound issues, dietitian would look at diet issues, and so on and so forth.
Absolutely. And it's one of those things where, again, it's at a high level, I mean, it all makes sense, but part of the devil's in the details. And I think, again, that underscores the value of having a partner who can actually explain these things. Not only explain, but though, I think one of the things we find important is that when we work with an organization, we help map out okay, look, what is your current workflow? What are your current staff resources? And then, it's important that we leverage our expertise to guide them. Okay, well, here's another organization that was like you, and this is the implementation that we recommended, where it was maybe more hands-on or hands-off or supercharged, instead of you having to figure on your own, well, what works here.
Yeah, I think that's a great addition as well. We're explaining these 3 workflows, but we're not saying they're set in stone, you have to fit within one of these. That's the other important distinction here is what is your current workflow and how can we fit into that or optimize it? It's not, choose one and stay with it. And that's the other thing, you can mix and match as well. So maybe you do want that live monitoring, but you don't have the time to, on the front side or in the front end, educate the patients. You just don't have the resources available. Well, that's fine. Give them the brochure, sign them up over their email, and then you can do the live monitoring and you can kind of mix and match different parts of the workflows that fits exactly with what you have. The next part, when you're implementing the technology, I think a lot of teams fail to consider or at least don't think about, what is the communication strategy that we have? And by communication strategy, I'm not just talking about how do we enroll patients, but the communication strategy that you have for educating the rest of your hospital, telling the other providers and staff, what is this initiative all about, as well as patients in the community? How do we communicate the strategy to patients in the community? So at a high level, I think your messaging for a communication strategy should cover why are you launching this initiative in general? When is it starting? What is the anticipated benefit of the program for patients, for families, for the hospital? And then also communicating, who are the key stakeholders where you can learn more about the initiative.
Yeah, absolutely. And I think it's one of those things where in a time right now where there's not a lot of great news sometimes, this is actually one of the really nice news stories that you should share with your community. Mm-hmm. I mean, I think it's innovative. It's about the patient experience. It helps improve the outcome. It keeps patients safe during COVID, and it's an understandable story by a patient in the community. So in a time where it's really hard to have positive, innovative stories for an organization, this is one that you got to celebrate.
Mm-hmm.
And you got to share that success, even just a launch, like share that success with your community, your team internally, make people like feel good about the work that they're doing here.
Yeah, absolutely. And I think, we'll touch on this at the end of the podcast episode, but we've actually provided a lot of examples for how the communication strategy could look in a white paper or ebook that we've launched on this very same topic. So we'll talk a little bit more at the end of the podcast on that and where you can find those examples. But there's a lot of examples that our partners have used, and we've kind of wrapped it all up in a nice, easy to read format. So we'll touch on that at the end. I think another part to implementing is to consider is how are you going to train your staff? How do you launch the program, and how do you educate patients? So loosely in line with the communication strategy, but I'd say the success of the monitoring initiative is correlated with the effective collaboration between your staff and care teams. So taking the time to properly train staff members on their responsibilities, I'd say pays dividends for the success of the initiative in its entirety. So certain processes are really important to consider. So number one, how do you educate patients about the platform? And that could be in the form of maybe a script that we give to our frontline staff. Here's how you can educate the patients. I mentioned about this ebook. We'll include some example scripts in there, for instance. But so first, how do you educate patients about the platform? Second process to consider is how do you enroll patients? So understanding at what point in time, how do you go about it, and make sure that your staff is trained on that. And then the third one is how do you manage the patient alerts and monitor patient status? If our staff is not trained on this and we have new staff coming in all the time and the turnover, or maybe it's a teaching hospital and there's residents coming in, we need to know these processes on how to train individuals about these components of the
Yeah, and
program.
that's a challenge. So if you're doing it on your own without a partner, it's, well, yeah, how do I educate a patient on this? Or what is a reasonable expectation for managing alerts if we want to do that? Or like, who's going to do that training?
Mm-hmm.
There's a ton of trial and error you'd have to do if you don't have a partner letting you experience and expertise. So this is, I mean, again, this we bring us at the end of this podcast, but it's such a critical piece.
Yeah.
It's what makes it work.
Yeah. I mean, I feel like we don't want to scare people off, so we don't want to put the important stuff at the beginning, but it really is something to consider, is how are we going to train our staff and team on this initiative. I think I'm going to just keep mentioning it, but the white paper that we'll include at the end actually has sample scripts, sample processes that we have in place. And so even if you didn't go with a solution like SeamlessMD for whatever reason, you can use those scripts and you can actually take that value and understand and implement it into your own program. All right, I'd say the second last piece on how to implement the technology is you need to consider what to do after go live and how to achieve ongoing success with the program. So we've kind of touched on the success criteria earlier in this podcast in terms of what data to review, but I think it's important to mention that you should have frequent data review and team huddles early on in the initiative. So looking at things like the patient adoption rates and activity rates, looking at the patient feedback. So actually understanding what patients are saying to your team. It could be about the technology. It could be about their care. It could be about the procedure. It could even be about their anxiety and some of the concerns that they have. You have all of this data available, so you should be reviewing it quite frequently. I think also reviewing staff feedback is particularly important, especially with workflow. Is it working with our team? So this is, I'm talking like, within the first 2 months of implementing the program, you need to know if it's working effectively in terms of your workflow. What is the staff saying about it? How do we improve it? How can we, take the success even further? And then just the last point is around using the data to identify, troubleshoot, and resolve any issues from a technology perspective, as well as, again, a workflow perspective.
Absolutely. All that makes sense. And again, like you said, more detail in the white paper. They want to unpack that further.
Exactly. Just the last thing I'll add with the what to do after go live from our partners in our experience, I think it's really important as well to share patient testimonials with the team. So it's kind of like, here's some of the success stories. Maybe you caught an infection early, because of the technology, and you should share that with your team. You should get them kind of fired up around that idea, and you can share it with the larger community as well. Hey, this technology is actually impacting patient lives, and it's amazing. Like, we need to be celebrating that.
Oh, and I mean, selfishly for the organization, especially if you're in the United States, where, let's be honest, you're competing for patient market share. Anything you can do to show that you're taking, frankly, better care of patients, you're extending your care beyond the four walls of the hospital, you should market that. I mean, you know, that should be a key reason why patients are going to your hospital instead of another one, because they know it's not, I'm not just getting a surgery, I'm getting a whole end-to-end, you know, care support for this whole journey. That's meaningful.
Yeah, absolutely.
You got to market it. I mean, people aren't just going to figure this out on their own.
No,
you know?
No, that's right. That's right. And I like one of the testimonials, and this is true from one of the patients, and you mentioned it earlier, but around, you know, this surgery experience was way better than my first surgery where I didn't have this technology. Like, that right there in a marketing campaign for a hospital in the States would do really well.
Oh, let me say, even if we're talking about like a non-competitive market, like let's say Canada, you know what? Like, let's raise the bar for, you know, the standard of healthcare. Like,
that's right.
Like, if you're doing it, spread the word. Like, first of all, you deserve the recognition for being innovative. But two is, if we kind of raise the tide for every patient and increase the, you know, the quality of care for every patient, that's a good thing. Even if you're in a non-competitive market, as a Canadian healthcare system, let's make this the standard of care. It should be. I mean, gosh, it's 2021.
Yeah. No, absolutely. The last things I would say, what to do going or after go live, what should you be doing? How do you achieve ongoing success? I'd say leverage the patient reported outcomes data. So in the aggregate form, looking at all of the patients who have gone on the platform, what are they reporting? And you can use that for quality improvement. So let's say, you know, you can monitor pain scores, you can monitor, you know, opioid consumption even. And what can we do internally to change some of these processes? Maybe we have a new pain regimen that we put in place. Does that actually impact pain scores? And we can use this for quality improvement. You can even look at some of the data like early mobilization and see, okay, looks like our patients are mobilizing by day 2. Can we get that even earlier? And what do we need to do? And does that impact pain scores? And you can see how everything kind of connects together from these patient reported outcomes. And I think that leads into the last piece that we have. I know SeamlessMD does this. I'm not sure about other vendors, but the ability to participate in user groups. So collaborating, learning, and disseminating best practices. Basically, these user groups are geographic specific. So in terms of maybe it's Ontario for Canadian hospitals, there's an Ontario user group. It can also be use case specific. We have a cardiac collaborative where different cardiac teams from across North America and across the United States can participate. They're basically collecting the same patient reported outcomes. So they have something that's benchmarkable, and then they can actually see who's a top performer in which patient reported outcome, and how do we strive to be like that hospital, and you can share best practices with each other. And so the idea is that everybody grows and gets better together by using the same information and by having access to that same information.
And then that's the other benefit of doing, I'll be honest, buy versus build. If you build, then you're kind of on your own. You're not at all connecting to other organizations. You're not sharing. You're not able to learn together. But besides that, I think being cheaper in the long run, frankly, to work with a partner, you're able to tap into that network. That is hugely beneficial, especially as you take your program forward, right? There's going to be so many new things in the future that you'll benefit from for being part of a larger team.
Yeah, absolutely. And then I'd say the last point that I would make on how to implement this, and we've kind of hinted at it the whole time, but celebrate the small wins. You know, implementing the technology, you should be celebrating that. That should be, you know, really getting the team on board with, hey, let's hope for the best for this initiative and actually celebrate that. When a patient first completes their program, you should be celebrating that. When you catch an issue or a risk with the program, celebrate that. And don't just celebrate it, you know, quietly with your team, but like share it with the larger care team, share it with the hospital, share it with, you know, maybe the world. Like it's important to celebrate these things because it is an innovation that you're doing. And I think the celebration goes a long way with ongoing success and team morale and rally behind the same initiative.
Totally agree. And especially if you're the first use case, the others who are looking at you, they want to hear what's going on.
Right.
Make them
Yeah.
jealous. You guys
That's
went
the
first. You
thing.
did the hard
Yeah.
work. You paved the way.
Yeah.
You
And
deserve that celebration.
I think traditionally we're very siloed in the hospital. And so by making an effort to actually celebrate something that's going well, it kind of breaks down those walls and barriers, and people can start seeing like, oh, hey, the cardiac department's doing something amazing. I want that technology too. And that's the way to get it is through that celebration.
Yeah, the other thing too is that this is an initiative that applies to every program. It's not as if, oh, we're trying this new knee surgery implant, that why would cardiac care about that? No. This is a program that could benefit everyone. It is meaningful to everyone. Your success matters to everyone. This is a hospital-wide opportunity at some point.
Right. Yeah. That's a great way to end, I think, the podcast. For folks listening or watching the episode, we have put together a full guide on how to implement surgical remote monitoring. It's in the form of a white paper or an ebook, and so we'll link that in the show notes. It includes a ton of free resources, including sample scripts or example scripts that you can use to educate patients, use to enroll patients, use to educate the community, as well as different resources and examples that you can sprinkle on through basically all of these criteria points for implementing the technology. It also goes into some in-depth overviews of all the topics that we covered today. We kind of did the broad strokes, high level on the topics, but the white paper itself goes into details on all of this. So go ahead, check that out. It's in the show notes below. And Josh, thanks so much for joining this episode. I guess we'll see you next time.
Thank you, Alan. Look forward to the next one.